COVID-19 situation for Tuguegarao City for this today. However, the data is from yesterday, April 29. That was Thursday. So far, no, from the start of this pandemic, we have now 4,311 total cases. 130 were added yesterday, as of yesterday. Ang total active cases natin is 1,072, no? Comprising, that's 25% of the total cases, no? From 4,311 from the start of the pandemic in March of 2020.
Len, sabi nga kung sino yon? Mag-unmute, mag-mute naman.
Yes sir. Kami na po ang mag-mute sa kanila.
Paki-manage. Okay.
Okay. We cannot give you actually the positivity rate, but let me just give you instead, no, how many individuals were tested for the month of April. That was from April 5 to 30, 2021 with 22 swabbing days. We have 3,877 swabs done this month, roughly around 186 or 87 swabs a day. So that's what we do. In terms of recoveries from the 4,311, 3,179, no, have recovered. That's 75% of the total cases. 75 recoveries were registered yesterday. Today, we have a total number of 60 COVID-related deaths, with a case fatality rate of 1.4%. Okay, these are your 10 affected barangays. 40, ano po ba yan, sir? Mali yan. 47 are positive, have cases. So, ang nangunguna pa rin is Ugak Sur with 109, Ugak Norte with 87, San Gabriel with 82, Tarig Sur, sa nakikita na natin po yan. At yung top 10 barangays nyo, no, if you isusuma natin yan sa 1,072, that will comprise around 53% of the total cases, no, active cases. Sa yung number 11 to 20 will account for around 22% of our cases. So pag samahin mo yan, 75%, 75% of the cases are found in these 20 barangays. Okay? So yun po yung mga ibang barangay, no? But we have 2 barangays with no case actually. Kasi ang problema dyan, kaya naging 46 lang, with 47 yan, we have problems with Carig, sir. Kasi pinaghalo yung Carig Sur at saka Carig Norte because when we input the data, wala po dun sa drop-down menu yung Carig Sur, Carig Norte. So ang nangyayari, sir, they're all lumped up into one. But we try to segregate it, no? Dito kasi sa data na ito, hindi na segregate kasi ginagawa pa lang yung data for today. Okay, as far as the cases, no, as of April 29, ito po yung active cases natin, 1,072. Kung titingnan natin, no, yung unang linggo ng first 2 weeks of April, from 2 to April 2 to 15, no? Meron tayong 904 cases. Ang average, with an average of 65 cases per day, no? And yung recent week, that is from the 16th to the 29th, which is your 14-day period, no? Meron tayong 1,086 cases. With an average of around 78 cases per day. So ito yung tinatawag nating attack rate. But usually we put it in 100,000 population. So we divide that by 1.64622, no? So we have at least around 47 per 100,000 cases, no, na nahawa o nako-confirm na kaso sa Tuguegarao City per day. With that, the epidemiological risk is still very high. Kung nakikita din natin yung case difference, no, from yung first 2 weeks sa third and fourth week is around 182 or a percentage change of 20%. Well, masyado malaki yung range, no, namin na tinitingnan dito 0 to 200, but this one has increased, no, from a mere I think 16 or 18%, nag-increase tayo ng 20%. Yung percentage change. Okay? Ito po, how did we fare from the start of this pandemic? Kung nakikita natin, in March of 2020, 8 lang po ang kaso. In April, we had 4. In May and June, and spilling in July, no, parang 10 weeks tayo dito, wala tayong kaso. Nagsimula tayong tumaas ang kaso ng July 9, July 2020 with 9 cases. It increased to 82, then to 119, to 104, to 153, to 246, to 569. Bumaba tayo ng February, but in March we again increased to 812. This time, no, almost 3 times the number in March, no, is meron tayong 2,047 cases as of yesterday. So that sums up to a total of 4,311 cases since the start. Ito po yung mga deaths natin. Kung makikita natin the first death, no, we never had deaths not until August last year. Isa po yung death natin. In September we had 2. In October wala ho tayong namatay. In November, no, may 3 tayong sunod-sunod ito na namatay. In December, we had 4. In January, we had 6. In February, we had 1. In March, we had 7. And ngayong Abril, no, we have 36 deaths. So that 36 accounts for around 60%, no? Almost 60% of our cases, of our deaths, no, occurred in the month of April. Okay, dito po nakalagay yung ating mga kaso sa ngayon. Yung sa on-home isolation, we have 830. Marami pa rin ho yan. Sa CVMC, we have 18 Tuguegareños. Actually, in CVMC, yung CVMC CIU, meron din silang container van, no? Meron silang siyam. Pero also here, no, in the CVMC psychiatry ward, meron silang, kasi there's an outbreak in the psychiatry ward, so there are 25 persons, no, cases there that are isolated actually at the psychiatry ward. One of them expired the other day. Okay? Sa hotels, no, ang CBMC is still maintaining quarantine hotels for their employees, at meron po isang nagpositibo doon after their stint or after their duty, no? Meron isa. St. Paul has actually 2 positive cases, no, are on isolation at St. Paul Hospital. 5 in Divine Mercy, 4 in RPGMC. Wala ho sa De Leon. Sa Tuguegarao People's General Hospital, they have 20, no? 20 COVID cases now being taken care by People's General. At the Demo Farm, no, yung dormitory, we have 23. Sa Demo Farm container van, which can accommodate 32, meron tayong 30, so may 2 bakante. Cagayan National High School has 18, pero ngayon dinilipat namin yung mga iba para mapupuno ho ang Cagayan National High School. So we're in the process of transferring kasi nag-discharge sila. Sa SDO, we have 41, no, out of 45 beds available. Sa Regional ICIU, we have 28. Sa RECOM, may 7 pa. There are other positive cases working in Tuguegarao, but they decided to go back to their own municipalities, so they're in their own municipal CIUs. May 11 tayo dyan, and then yung sinasabi ko nga na may outbreak sa psychiatry ward ng CVMC, so may 25 doon. Okay? So this is in summary, yung ating mga tinatawag na CIU, we call them temporary treatment medical facilities. May 193 tayo dyan, kasama po yung nasa munisipyo. So which accounts only for 18%. For those on home quarantine, 77%, no? Inpatient, we have 49, accounting for 5%. Yung mga inpatients na ito, no, are those that are really on the severe and critical level, critical condition. That's the reason why makikita natin na medyo sunod-sunod ang deaths natin sa Tuguegarao City. And one of the reasons is hindi gaya dati na natatanggap ka agad sila and treatment is instituted immediately. Sa ngayon, medyo dahil sa decking, we just referred one patient today and he's in deck 83, no? 83 sa CVMC. So number 83 before he can get in to that he can get admitted to CVMC. Okay? Hinati ko lang ito, no? Pero yan lang, let me just call your attention to April 24, 25, 26, and 27, no? When we were trying to reverse, no? Nagre-reverse dito, mas marami yung recoveries natin kaysa sa new cases natin. However, 2 days ago, no, nung 28, medyo nakadismaya dahil mga 143 ang nagpositibo pero 80 lang po ang recoveries natin. Also yesterday, we had 130 positives again and we only had 75. No? So makikita natin yung disparity. Ang total cases natin, no, na nakita for the month of April is 2,047. Samantala, ang recoveries lang natin is 1,525. Okay? So ito po yung active cases natin. And of course, I told you about the 36 deaths, no? So makikita natin, no? More than 1 death per day because we only have 29 days, no? And we already have 36 deaths. So makita natin na mas marami ngayong namamatay for the month of April. Let's hope that this doesn't spill over for sa Mayo. Anyway, I just put this in bigger figures, no? In a bigger font. Hinati ko lang siya. So para makita natin. Okay? So ito po yung April 24 and 27. Ito yung kinukuha ko yung attention nyo. Kasi bumaba na tayo ng 960 again. We increased to 1,018 the other day and yesterday is 1,072. Okay, this is how it looks though in the picture for April 1 to 29, makikita natin. We thought all the while that our peak, no, in April was was April 23 when we had 1,131 cases. Hindi pala. Kasi mas marami tayong kaso ngayon. Yesterday at 1,072. Okay? So the highest number of active cases for Tuguegarao City for the whole period of the pandemic was April 29, wherein we registered 1,072 active cases. Okay, ito lang, how did we fare for the past year, no? In March, ito po yung I just put it in a table and combined it with a graph para makikita natin. Makita natin yung laki ng spike, no, for Tuguegarao City, no, for the month of April. From 812 in March, naging 2,047. Also with the deaths, no? Okay, it's the same. Okay. Ito nagpapakita na pati kami, no, mga health workers are not spared from COVID. So makikita natin na meron ka out of the 156, no, 59 generic employees of the City Health Office, yung plantilla position, yung mga detailed coming from other departments, and yung mga job orders natin, including yung HRH, yung Human Resources for Health, na galing sa DOH, Regional Health Office 2, at saka yung contact tracers natin from DILG. We account for we have 156 people working at the City Health Office. 20 of us have already had COVID, no? At ito yung isang dentista, isang nurse, 3 NDP nurses din ito, isang nutritionist, 4 na midwives, 2 RHMPP or mga midwives galing from the region. We also have one sanitarian, admin staff, meron tayong isa. Yung mga detailed personnel, yung mga GIP, at saka yung mga detailed sa amin. Yung first day nila, we usually test them and they tested positive. No? In fact, yung isa dyan, nahawa niya yung nutritionist natin. And of course, 2 of our drivers, no, who ferry our swabbers and our positive cases, no, have turned out to be positive. So from this 20 account for around 13% of our staff, no, have actually tested positive already. I think 4 of them are on isolation. So yan po ang kabuuan ng ating mga kaso sa siyudad ng Tuguegarao at sino ho yung mga nahahawa, no? We are trying to have a more in-depth analysis, no? But we need more people to help us here. However, the mayor said he will get us probably someone like an epidemiologist who can help us analyze the data so that we can analyze and give you a deeper understanding, no, of the dynamics within the household and within the workplace. So I think that's the last slide as far as the COVID, no. But we would always say kami pong mga nasa kagawaran ng kalusugan, ang hinihingi ho lang namin ay sa atin lahat na manatili sa bahay, no. Sa pagmapanatili sa bahay, we protect yourself, we protect your families, we protect us, the frontliners, the community, and of course the country as a whole. Okay, so that's it. Thank you very much.
Thank you, Dr. James. Thank you, but may I request Dr. James to explain the situation of our home quarantine? Why is it that we have so much home quarantine? May I also request Dr. James to explain as to
Yes, sir.
the practice of DOH or even the World Health Organization pertaining to home quarantine.
Okay, doon sa home quarantine, no, unang-una, siguraduhin natin na yung mga supposedly yung mga bahay, no, ay meron sariling kwarto at dedicated na toilet. However, kung wala pong dedicated na toilet, tinuturuan na po natin sila kung paano mag-disinfect. So you can always adapt, no, to the current situation. We all know that not all households have an extra comfort room, but for those households that have good sanitation practices, no, nakikita din natin na maski kung may nagpositibo sa loob ng bahay, kung lahat tayo ay gumagamit na ng mask pag may na-isolate sa ating mga kabahayan, ay pwede hong hindi mahawa yung mga ibang mga tao or mga members ng household. Pangalawa, kailangan din po, no, ang sinasabi ng World Health Organization, hindi lang yung paggamit ng mask, paghugas ng kamay palagi, at saka yung paggamit ng at paghugas ng kamay, at saka yung pag-disinfect. Kasama din po dyan na pag ikaw ay naka-home isolation, na pinayagan natin ikaw sana ay nandun lang sa loob ng inyong kwarto at doon na po kayo kakain. Well, we do not, no, as a rule, we do not like to do home quarantine. However, since we have very limited number of isolation beds, no, we have to be very selective as to whom to home quarantine. Unang-una, hino-home quarantine natin yung medyo nga maganda yung dwelling place. Meron sariling kwarto at may toilet. Pangalawa, pag lahat po ng mga bahay, no, yung mga membro ng pamilya ay nagpositibo na, then we better lock them down. In fact, that's what our neighboring municipalities and the cities are doing. That in fact, some of them do not even test, and based on the data, no, we are the ones that are aggressively testing. But that's good because we actually know the real score, the real picture of our city when it comes to the positives, no, in our city. Again, in terms of when we do isolation in the home, okay, unang-una nagpapadala tayo ng parang COVID kit sa kanila, nagpapadala tayo, meron hong disinfectant, meron hong tayong mga mask, meron hong tayong face shield. At bawat miyembro ng pamilya na nagkakaroon ng positibo ay binibigyan natin ng packet of medicines, very basic, paracetamol para dun sa lagnat at saka pananakit ng katawan, yung ating vitamin C, no? Which will help spruce up our immune system. Isa pa, no, sana ito mag-register sa ating kaisipan at gawin po. Pag kayo po ay sa at this particularly siguro sa ating mga kapitan, no, na pag ang mga tao ay kailangan pag sila po ay naswab, kailangan manatili sa bahay. Naka-quarantine dapat po sila at hindi lalabas sa bahay. Ang gustong sabihin niyan, no, ay ayaw natin ikalat sa iba pang mga tao. Just in case we confine it to ourselves. And of course, no, not even our families, ayaw natin na mahawaan natin pamilya. So kailangan mag-quarantine or mag-isolate sa loob ng sariling kwarto. So yun po, you have to stay home. Lalong-lalo kung may positibo sa loob ng bahay, kailangan po na ikaw po ay mag-stay sa bahay, whether you test positive, then we will try to isolate you. Kung marami pang mga ibang mga miyembro ng pamilya na hindi nagpositibo, na they test negative, so we have to extricate you, tatanggalin po kayo sa loob ng bahay. Pero yung merong magandang dwelling, then we may allow them to go on home quarantine, provided they report to us or they are being monitored. Aside from that, dun sa home quarantine, we also have our medical clerks from the St. Paul University College of Medicine na nagmo-monitor ho sa kanila. Yung mga kapitan, no, patulong na lang po, sabihin natin sa mga constituents natin na ito po ay legit. Kasi may mga nagtatanong kung yung mga nagmo-monitor ba ay legit. Aside from that, pag meron tayong mga ganun na mga pamilya na medyo marami, okay? Meron din tayong pinapahiram na pulse oximeter para mas objective ho, no? Mas makatotohanan yung assessment natin sa kanila. So, yan po ang mga ginagawa natin. At meron tayong packet, in the packet of that we give, no? There are instructions on what to do basically in the home. So, yun po, sir.
May I add to that? The practice of home quarantine is an accepted practice all over the country. The purpose of which is to decongest our TTMF and of course our healthcare utilization. That's one of the purposes ng home quarantine. While ang gusto ng ang ideal practice ng DOH, ang sabi ng DOH is 10% ng dapat. Ngunit nahirapan po tayo sa Tuguegarao. Kasi ang home quarantine natin, we are maintaining 5 isolation facilities. We have 1 in SDO, second is Kaya National High School, we have our TCPGH, and 2 sa Demo Farm. It's a 186 bed capacity isolation facility. Ngunit nag-surge. What happened? We resorted to home quarantine, which is not very ideal. Hindi talaga ideal ang home quarantine. But we have no choice. Why? We were offered a 50-bed isolation facility by OCD. We cannot man it. Why? Dahil po, per facility, we have to maintain 4 to 5 teams. And a team is composed of 6 people over and above yung supervisor na doktor. 2 nurses, 2 nurse aide, 2 utility. At any one time. So ano pang ginagawa ng 4 na teams na yan o 5 teams? Mag-duty po ng 1 week yung isang team. Diretso po yan, 24/7. After which, they go on quarantine for 14 days. After 14 days, they go home for 1 week or 2 weeks. Len, makuha mo ako?
Yes, sir. Yes, sir.
Okay. 1 week or 2 weeks, depende kay Dr. Marcos. So, puno po tayo. Okay, bakit hindi tayo mag-hire ng tao? Okay, ganito pong sitwasyon. DOH gave us 5 initially last month. We posted the 5 kung sino ang pwede mag-apply na nurses. 3 lang ang nag-apply. Ang bayad niyan sa nurses, I think 33,000. Okay. Nagbigay ulit si Director Rio. Maraming salamat, Director Rio. Magpantay. DOH Rio ng 20. Kasi humingi po ako sa kanya last month. Nakapost pa lang po ngayon. Hindi ko po alam kung meron pa pang nag-apply. So we have a dearth of health workers. Health workers. Okay. Hindi natin pwedeng maglagay sa mga basta-basta maglagay po sa mga barangays natin. Kasi nga, wala rin mag-aalaga doon. Yung barangay, they have to come up with how many people to man our isolation facilities in the barangays. Kung ang mga trained na nurses at doctors nahahawa na, ano pa kaya kung sa barangay natin ilagay? Kahit i-train po natin sila. So, ang tingin ko rin is we will be unduly putting them in danger. Kung ginagawa po sa ibang municipalities yun, hindi ko po pwedeng gawin sa Tuguegarao na unduly endanger our people in the barangays also. Baka lalong madadagdagan po yung problema natin. Madadagdagan yung problema natin. So, yun ang rason kung bakit we cannot go on, we cannot put up isolation facilities in the barangays. Hindi rin naman po, ang proseso po kasi dyan, you cannot just put up an isolation unit. Mas as you want, it has to be accredited by DOH, not because for PhilHealth purposes. No, hindi. Hindi po for PhilHealth purposes. Hindi naman nagbayad ng PhilHealth sa atin. But not for PhilHealth purposes. Ever since wala pong binayaran ng PhilHealth sa atin. Pero it's not for PhilHealth purposes. It's for us to follow the process of DOH. Ang gagawin po ng DOH, ini-inspect po nila yan. Hindi lang naman po sa isolation facility. We cannot just put up an isolation facility. Yun po ang palagi sinasabi ko dun sa mga kaibigan natin. Na bakit hindi kayo magtayo ng isolation facility sa barangay? Hindi nga talaga pwede kasi magkakalat lalo sa barangay. Positive yung alagaan ng mga barangay dyan. I am willing to put up the isolation facility kung sinong barangay ang sinabihan ko barangay captains, kung sino ang barangay na mag-volunteer, I will put up the isolation facility. I will give you all the equipment that you need. Yung PPEs, we will train your people. Walang mag-volunteer. Iisa ang nag-volunteer ang nafunan is. Ngunit, hindi ang nag-commit, hindi yung barangay captain, ang SK chairman. He cannot because he is not the father of the barangay. It has to be the barangay captain and the officials. Kasi walang support. What will we do with an isolation unit without the support of the barangay? So yun po yung palaging ini-insist ko na hindi po pwedeng dalhin ang problema sa barangay. Ang gawin ng barangay, i-isolate na lang sa home. This is a recognized practice po buong mundo. Not only in Tuguegarao, not only in the Philippines, is in the whole world. The home quarantine is recognized, only sobrang dami na sa atin. Kasi nga hindi makarry. That's why we're putting up again another isolation facility of about 80 to 100. Binigay na po ni Director Paragas ang go signal sa akin, yung Science High School, i-convert na po namin, ginagawa na po namin, co-convert na po namin ng isolation facility. Kahit alam kong medyo reluctant si Principal Akain dyan, ngunit sana maintindihan po niya yung sitwasyon natin. So this another 80 to 100 bed capacity po na isolation facility. Doon natin dalhin po yung mga pwede nating dalhin, yung kailangan na dalhin po natin sa isolation facility. That is the reason why we cannot just put up the isolation facility anywhere we want. Kung before naglagay po tayo ng step-down quarantine facility. But it's quarantine, yung mga LSIs na dumarating. But sa isolation, we cannot. Positive po ang mga yan. Okay. What did we do to help, Dr. James? We nag-put up po tayo ng COVID-19 command center sa CHO. Sa CHO, it's manned 24/7 by 3 lines, 3 devoted lines. Please take note, 0936-888-1902. 0936-888-1902, 0936-888-1308,
Yeah,
and 0908-240-7005. Tatlo po yan na devote lines. Yan po is man 24/7. Ang first line of information po natin na nag-aasikaso sa mga nasa home quarantine ay yung mga medical students ng St. Paul. Maraming salamat po sa inyo. Yung senior medical students ng St. Paul. Sila po yung nagmo-monitor, and then ang nakaback up po dyan yung IT students din ng CSU. Maraming salamat po kay President Jay at saka kay President Mercy ng Merceditas ang ng St. Paul. Pinayagan po nila yung mga students nila. Ngunit, per cluster po ng students na yan, meron pong naka-assign volunteer doctors. Maraming salamat sa mga doctors po natin na nag-volunteer headed by Dr. Valencia. Epidemiologist po natin yan on infectious disease. Sila po yung kinokonsulta anytime ng mga students pag hindi na po nila masagot yung mga tanong. So marami pong doktor sa nag-volunteer. Marami pong tumutulong. Ngunit yung home quarantine, hindi talaga masolbahan po yan. Ginagawa po namin ni Dr. James ang magagawa namin sa Dr. Marcos. Kaya nga, sana maintindihan ng mga kaibigan po natin, ng friends of the media, why we cannot put everybody on home quarantine. That is an accepted practice in the entire world. Only hindi ideal ang sitwasyon natin kasi 10% ang gusto ng DOH. Hindi naman, alam naman ni Dr. Rio na wala na po kaming paglagyan. Wala po kaming paglagyan. Kung meron lang, ilalagay po namin lahat dyan yan. Mapapakain po namin yan. Meron pong pera tayo. Meron po tayong pera. Hindi po dahil yan sa PhilHealth. Hindi po yan dahil sa PhilHealth. At saka wala pong pumepera dyan kahit 5 sentimos. Kasi paano ka naman pepera PhilHealth naman yan? Pupunta sa kaban ng gobyerno po yan. So gusto ko lang i-explain yung sitwasyon natin sa Tuguegarao na ganyan po ang sitwasyon natin. Ang pinakamaganda, mag-ingat po tayo. Palaging yan po ang sinasabi ko. Hanggat ma-reach natin yung herd immunity na sinasabi nila. Medyo matagal pa yan. Up to next year pa yan sa tingin ko, mga kapatid ko. Yung AstraZeneca na in-order natin sa Baguio, third quarter pa yan, sabi ni Mayor Benji Magalong. Sir, third quarter pa yan, sir. So, mga kapatid ko, mag-ingat po tayo. May I now request, thank you, Dr. James, for that. If you want to add anything more, Dr. McCoy, Dr. Marcos, Dr. James, thank you again for your time. May I now give you Dr. Jokari Chua, the head of our vaccination teams in Tuguegarao City. She's the chief of the vaccination process in Tuguegarao City. Dr. Jokari, may I request you to give us a brief update on our vaccination process, or where are we now in Tuguegarao City so far as vaccination is concerned? Thank you again.
Yes, good afternoon po. Thank you, Mayor. Good afternoon po sa inyong lahat. So I would just like to share with you our accomplishment for the COVID-19 vaccination sa Tuguegarao City po. So, sa ating accomplishment po for the COVID-19 vaccination as of today, halos tapos na po namin magbakuna on our A1, which are the frontline health workers. This includes yung ating COVID-19 referral hospital, the public and private hospitals providing COVID-19 care, our isolation and quarantine facilities, yung ating remaining hospitals, yung government-owned primary care-based facilities, the standalone facilities, and the closed institution setting. Kung titingnan po ninyo nito, ang nabigyan na po ng first dose among our eligible population is 5,052, which approximately 71% po. However, may magse-second dose pa lang po tayo sa mga nabigyan na po ng first dose. Ang nag-second dose pa lang po is for the COVID referral hospital is nasa 93% lang po ang completed. And then for the public and private hospitals providing care, 62% pa lang po ang completed. So yung ating mga second doses po for the isolation and quarantine facilities, the remaining hospitals, magi-start pa lang po ito by May 12, 13, and 14. And sunod na po yung mga second doses nila. As for the A2, kasama po dito ang seniors, hinati lang po namin as to indigent and the non-indigent population ng mga senior citizens. Kung titignan po natin dito, ang eligible population for the among the indigents is 6,223. Pero ang nagpapabakuna lang po is mababa po yung percentage ng nagpapabakuna among the indigent senior citizens. So sa 10 barangays po na na-cover natin, among the indigents, 141 lang po ang nagpabakuna among the indigents, which covered around 2% po ng ating eligible population. So ang ginawa na po namin, since nasa amin yung bakuna, pinalitan na po namin yung mga umayaw po na indigents, pinalitan na po namin sila ng senior citizens from their own barangay. So among the non-indigents, meron na pong nagpabakuna na 1,070 of the 10 barangays po na natapos namin. So ang total na na-vaccinated po namin na senior citizen is 1,211, which comprise around 6% po of our eligible population. So as to our vaccine availability po sa City Health Office, ito po yung ating number of vaccines. So we have a total of, sa first dose po ito, we have a total delivery of 3,165. Ang nagamit na po namin is 2,900 and we have a remaining 262 na doses po ito ng Sinovac. For AstraZeneca po, ang total po na naibigay nila sa amin is 117. Nagamit na po lahat yung 117, so wala pa po silang binibigay na additional for the AstraZeneca. For the second dose po, ang nabigay na po nila is 3,165. Ang nabigyan na po ng second dose is 948. Meron pa po kaming remaining for the second dose na 2,217. So, ang ano ko lang po dito is sana po mahikayat po natin, especially nasa senior citizen pa lang po tayo na eligibility group, sana po mahikayat po natin talaga na magpabakuna, lalong-lalo na po yung mga indigents, na magpabakuna po for the COVID vaccine para po papataas din po ang ating acceptability rate. Thank you po, Mayor. Ito lang po yung sa akin, sir.
Thank you, Dr. Jo. Thank you very much. We will update you, gentlemen and ladies, as regards our progress in our vaccination once the vaccines will arrive again. Plus, please take note, Dr. Jo, that we still have about more than 2,000 remaining for the second dose.
Yes, sir. Yes,
And
sir.
you will start your vaccination sometime May 12.
Yes, sir. Yung Wednesday po yun, sir. May 12, 13, 14 po ata yun, sir.
Okay, thank you.
Wait, sir. Angin ko lang. Yeah, it's May 12, 13, and 14 ang second dose, sir. Start ng second dose po yun.
Thank you, Dr.
And-
Jo.
Yes, sir.
Yes.
Addition lang. As to the schedule po kasi ng vaccination, hindi pa po namin ma-finalize, sir, kasi we're still awaiting kung ilan po yung allocation na ibababa po sa amin ng DOH. So hindi pa po namin mabigay sa inyo, baka po tomorrow or Sunday, mabigay na po namin yung schedule namin for vaccination for next week po.
Thank you, Dr. Jo. Thank you. So, gentlemen, ladies, that's the situation update. as regards our COVID-19 situation and our vaccination, progress of our vaccination in Tuguegarao. So, may we proceed now to our quarantine level. The executive order or the approval of the regional IATF that they gave us when we requested for the downgrading or the escalation of our quarantine level from ECQ to MECQ, stated in that resolution of the regional IATF is we can extend for 10 days the MECQ once the situation doesn't really improve. So automatically, we gave already a request to the governor for the approval of our extension, which he immediately endorsed at the regional IATF. But the request of the governor is to place Tuguegarao under 30 days MECQ, the whole month of May under MECQ. My request, my recommendation to the regional IATF is for 7 days muna. Mag 7 days muna tayo. Tingnan po natin kung anong sitwasyon natin. We take the cue from Metro Manila. We take the cue from Metro Manila. So mga kapatid ko, yun po yung situation natin. Yun po yung situation natin sa Tuguegarao. So automatic po, our quarantine level starting tomorrow will still be MECQ up to May 7. And then we will cross the bridge when we are there. Yun po yung inilabas po natin na executive order. But in consultation with our leaders in the community in Tuguegarao City, we had a meeting with the Vice Mayor, the City Council, and all the barangay captains, and all our department heads some time ago, and we agreed that we will extend our MECQ to 7 days. So may I now give Atty. Net on the latest protocols. Walang pagbabago ang protocol, ngunit mayroong pagbabago base po sa binigay po ng National IATF. Mga kapatid ko, ito we always follow yung ibinibigay po ng National IATF. Hindi lang po gawa-gawa po natin ito. Ito po yung nanggagaling sa taas. Wala po kong ginagawang desisyon sa Tuguegarao na hindi ko po kinakonsulta. Ang DOH, si Director Rio Magpantay, as si Dr. James, as si Dr. Makoy. Kung meron po akong gagawin, sila po yung pinakamaunang tao na kinokonsulta ko pag desisyon po kami. And then sa kanilang po kami mag-usap-usap ulit. So ganun po yung ginagawa natin. May request, Atty. Net. Atty. Net, please take over.
Yes, Mayor. Good afternoon, Mayor, and good afternoon to everyone. So allow me to share screen the copy of the Executive Order number 64, extending. Can you see my screen share, Mayor?
No, we cannot see. We cannot see.
Can you
Doc,
see it
Doc,
now?
Doc, yan, okay pa.
Can you see it now?
Yes, attorney.
Okay po. So, this is our Executive Order number 64, an order extending the implementation of MECQ in Tuguegarao City for another 7 days po, which is effective from May 1 to midnight of May 7. Wala pong pagbabago sa ating protocols po. So the guidelines and protocols embodied in Executive Order number 56, which is our first MECQ last April, and Executive number 59, which extended our MECQ April 20 to April 30, 2021, shall continue to be implemented in the entire city, but with the following amendments. Because last night, during its 113th meeting, the Interagency Task Force for COVID-19 has approved following business establishments to operate during the period of MECQ. So first, the IATF allowed restaurants, eateries, commissaries, and other food preparation establishments to resume their indoor dine-in services at an initial 10% po of their seating capacity. Second, beauty salons, parlors, barbershops, and nail spas shall also be allowed to resume their operations at an initial 30% of the seating capacity. But take note po, under the IATF guidelines, these establishments may operate beyond this limitation. So for the restaurants, they may operate beyond 10%. The beauty salons, they may operate beyond 30%, provided that they comply with the Joint Memorandum Circular number 21-01, Series of 2021, or the Safety Seal Certification Program. Mayor and everyone, allow me to present to you a brief discussion on what this Joint Memorandum Circular is. So under the Okay, so the Joint Memorandum Circular number 21-1, it was issued and signed by 5 different departments, the DOH, DILG, DOT, DTI, and the DILG po. This was issued last April 23, 2021. So, ito pong Joint Memo Circular number 2101, ini-encourage po ng ating pong national government ang all business establishments including government offices to comply with this Joint Memorandum Circular. Ano po bang tinatawag? Ito po yung pag-i-implement po ng Safety Seal Certification Program. Ito po yung paglalagay po nila or papaskill ng isang sticker signage sa isang establishment ng safety seal. Ito po yung parang itsura po niya. So, ang ating pong public, ang ating constituents, when they see a business establishment having this kind of sticker na nakapaskil po sa kanilang business establishment, they will be at peace, knowing that this establishment complied with this memorandum circular. Paano po ba makakakuha ang isang business establishment ng ganitong seal, safety seal? First, they should know kung sino yung issuing authority. So, business establishments should check kung saan po sila pasok at kung kanino silang issuing authority na lalapit po. So, for those business establishment previously mentioned, for the barbershop and salons, if they intend to operate beyond the 30% initial limitation capacity, they need to go to the DTI to ask for the issuance of the safety seal, but they need to comply with all the requirements. So, if the DTI will inspect that business establishment at nakita po nila na compliant sila, then they may operate beyond that limitation. For the for the fast food, for the eateries and restaurants naman po, ang issuing authority ay LGU. So for all those food preparation establishments in the city that intend to operate beyond the 10% dine-in capacity, they may apply for the safety seal certification program at the City Hall po. So we will conduct inspection and we will see if compliant po kayo. Mayor, everyone, allow me to present to you the brief guidelines po or requirements po to qualify for the safety seal certification. So first, the issuing authority po will check if you are compliant with registration and accreditation requirements. So we will check if you have mayor's permit, DTI permit, or accredited by government institutions po. And second, this is one of the very important feature po of this program, the use of the staysafe.ph po. Because the national government instituted this contact tracing app, ito pong staysafe.ph, para ito po yung maging nationwide na contact tracing application po for the entire Philippines. But as of today, medyo hindi maganda po yung pagtanggap ng iba't ibang establishments sa implement po nito. So by complying with the safety seal certification program, kailangan po na mapatunayan nyo na gagamitin nyo itong staysafe.ph as your contact tracing tool in your business establishment. So if you will not utilize this application as a contact tracing in your business establishment, then you will not be given the safety seal. You will be considered non-compliant po. And you must also comply with the minimum public health standards, like you should put up a triage area at your business establishments. So in that triage area, yung customers and other individuals entering the business establishment are asked to register with staysafe.ph. So meron din pong health assessment check dun sa triage area. And then we will also check yung availability po ng hand washing stations like soap, sanitizers, and hand drying equipments or supplies po to employees and clients. Observance din po ng physical distancing or spacing po through installation of physical barriers in enclosed areas where physical distancing may be compromised. And we should ensure din po adequate air exchange in enclosed or indoor areas as cited in DOLE Department Order po. Also, we will also require these business establishments to implement disinfection. So they should implement disinfection po dun po sa kanilang business premises. Then wearing a face mask, face shields, especially in enclosed places, and wearing other protective outer garments as warranted po. Also, they should establish a referral system for medical purposes. So dapat po meron po silang i-designate na safety officer who shall coordinate with the appropriate bodies just in case po yung may client po or visitor na papasok sa business establishments nila na bumagsak po dun sa triage assessment po nila. And then they should also have a facility for proper storage and disposal po, or the face mask and other infectious waste po. So ganun lang po kadali. Kung gusto nyo po na mag-comply po dito sa ating safety seal certification program, then you may check the list kung saan po kayo pasok na bracket, kung sino po yung issuing authority. Then you may visit the office of that issuing authority and schedule for an inspection of your business establishment. And once compliant po kayo with all the checklists given, then you will be given the safety seal and you will put display it in a conspicuous place in your business establishment. So that's all, Mayor.
Thank you, Atty. Net. Expert na si Atty. Net sa mga protocols natin sa mga MECQ, GCQ, ECQ. But this is a new one, a new process, yung safety seal that will be issued by the local government, that will be issued by DTI, DILG, and DOT, Department of Tourism. So iba-iba po yung protocols dyan. So we will give you a copy of, we will also post in our CIO, Len, we will post in our CIO yung mga proseso para sa safety seal so that we can issue it to our establishments. So
Yes, Mayor.
Yes, is the CA on board? The Vice Mayor on board? Do you
Yes,
have anything
Mayor,
more?
they are po.
Vice, do you have anything on your table? Wala pa si Vice. CA, do you have anything on your table? Wala rin pa si CA. Anybody among the members of the 8th City Council, do you have anything on your table before we go on open forum? Yes.
Mayor, present si Vice kanina pa.
Yes, I know. Do you have anything on your table to take up?
Mayor,
Do you want to take up anything before we go on Q&A?
Mayor, actually, I already mentioned it to CA a while ago. Siguro po tignan din po natin yung mga katulad pa yung sa mga umiikot po, yung sa Mormons, yun sa mga yun ibang religious group po na naglalakad na umiikot, Mayor. Even MECQ umiikot pa rin sila. And yun isang kakilala po ng ate ko, hindi siya lumalabas po ng bahay nila, and it just so happened na nakausap niya po yun sa mga ano po ng isang religious group po, at na yun yata parang may symptoms siya ng COVID kaya magpapaswab din siya. So dapat sa mga barangay captains po, barangay officials naman, pag may nakikita po tayong umiikot na regarding sa mga religious po, hindi naman po sa ano, pero kailangan po natin na wala munang gumagalaw or umiikot. Yun lang po, Mayor.
Thank you, Ben. Thank you. Barangay captains, please take note. We have an observation brought to the attention of the Vice Mayor that meron pa rin yung mga mission, yung mga umiikot. Pagbawal po natin muna yan. Essential muna tayo. Kahit nga yung mask, very limited po yung holding ng mask. Yan pa kaya. So ipagbawal muna natin mga kapatid ko yung mga ganun. Kailangan very active po yung ating neighborhood watch. Kaya nga po yung neighborhood watch natin, nandyan naman po yung mga landline natin na nakadevote sa devoted to our neighborhood watch, yung 0956-347-7979, yung Dano. Nandyan po, 0956-347-7979. Magsumbong po kayo dyan, aaksyonan po yan. Nandyan din po yung sa PNP natin. So mga kapatid ko, yung neighborhood watch natin, let's all be very vigilant. Makita ninyo kung minsan hindi po namin mabantayan po lahat. Si Colonel Jonalyn Tekbobolan, nandyan po palaging umiikot din po siya, ngunit hindi po talaga imposible po na mabantayan po namin lahat. Dagdagdag na rin po ng mga patrol teams si General Aldi Nieves at si Colonel Arnel Kilang sa Tuguegarao. Maraming salamat po sa PNP po natin. Nagdagdag po sila ng mga para sa checkpoints at saka yung umiikot po sa regional mobile force po nanggagaling pa yung umiikot na mga teams sa mga barangays. Para sa ganun po, mapagsabihan po yung mga tao. Hindi naman po yung purpose nila manghuli. Ang purpose po nila is warningan ang mga tao. Para sa ganun yung mga tao sumunod po sa mga protocols ng gobyerno po natin. So maraming salamat. So may we go now to our Q&A? Anybody from the City Council?
Mayor.
Yes, Councilor Danny. Yes.
Tiga pagkalaman niya rin, duwa nga pulis nga na-assign mo na po sa top 20 barangays.
Yes, we have. We have 2 policemen detailed na, hindi detailed talaga to our different top 20 barangays sa COVID. Naka-assign talaga yan sa barangay.
Igan ako ang suggestion ko, Mayor, that we will now focus on the preventive aspect of this issue, Mayor.
Yes.
We maximize the presence of the 2 policemen in the top 20 COVID infected barangays. Na ada naman medjatari, pagkatruk kuman, for the barangay officials prevent the infection. Bungan na yung pulis nila, pero mapagimang da i-gathering. Yari i-misisimu to barangay ra. Afagadan nga mag-gather. So, dapat igen magpagaman nila nga magdududum mo like gilangan, ikabang birthday, kay minum. Ako to malebo. So, we make use of the two policemen and the barangay officials to do that. So, as investigation. Yan na, sige.
Thank you, Cons Danny. The purpose of why we place our policemen in the barangays, we detailed policemen in our top 20 barangays, is para nga umikot kasi hindi na nga medyo takot ang tao sa barangay tanod, ganon. So kaya dapat umikot yung police natin, and I already gave instructions to Colonel Tecbobolan for that. Colonel Joe, I hope you are on board. Please go around again. Go around again, and instruct your people to go around. Do not wait for the barangay officials to go around. You go around. It is your duty now. Tell them that it's your duty to go around the barangays and remind the people of protocols. Kapag may nag-insist, then saka lang po tayo manghuli pag in-insist po nila. But the main duty of our policemen, you go around in uniform. So yun po yung sitwasyon po natin. Yun, kaya nga naglagay ako ng 20 dyan, Dan, sa 20 barangays. That's the main reason why we place them there. And may I remind our leaders in the barangays, please use them. Use them. Ang requirement ko pa kay Colonel Joe is dapat may motor yung dalawang pulis, kasi karamihan naman ng pulis may motor. So may motor yung pulis para sila na on their own iikot. Meron ng assignment yung ang nagpapakain na nga dyan, sinabi ko yung barangay. Homework na ng barangay yun, responsibilidad ng barangay na pakainin yung pulis para hindi po alis yung pulis doon sa mga top 20 natin.
Thank you, Mayor.
Thank you.
Mayor.
Yes, Boyet.
Yes, sir. Magandang hapon. Sir, meron tayong proposed na resolution siguro by Monday. Ang nawawala sa atin is yung sa mga government agencies, every 3 o'clock magkaroon tayo ng 3-minute prayer. At masyado tayong nakafocus sa kung ano yung mga dapat gawin tungkol dito sa COVID. Yung mga iba puro nakatutok sa mga Facebook nila. May proposal din resolution tayo, sir, sa lahat ng government agency by Monday maipasa na all government agencies within Tuguegarao na magkaroon ng 3 o'clock prayer, mga 3 minutes na prayer para sa kaligtasan at para sa ating lahat, Mayor. Thank you very much, Mayor.
Thank you for reminding us, Cons Boyet. We will only encourage. We cannot mandate them to go on the 3 o'clock prayer. We will encourage those yung mga Catholics to go on a 3-minute 3 o'clock prayer. But umpisa na po natin sa CIO. Len, every 3 o'clock we post our prayer, 3 o'clock prayer in our CIO. Every 3 o'clock in the afternoon, including Saturday and Sunday. Len, that is your job.
Sir, yung sa Mecq natin, sir, yung sa Mecq, yung mga mga pastors, may request sila.
Yes, Boyet. Yes, we will do that. Yung mga Christians din, meron din silang ganun. We will do that. We will. Thank you.
Mayor, good
sir. Thank you.
afternoon.
Yes, Clem, good afternoon.
Thank you po, Mayor. In line with that, tama po yung sabi ni Sir Boyet, lahat po nakatutok sa guidelines, sa protocols, lahat po ng mga dapat gawin or sa Facebook. So I would just like to invite Mayor, all our barangay captains, all our department heads, and SK chairmen for the incoming Global Leadership Summit. This is for us to check on our leadership health, on our mental health, and leading with confidence in the midst of the pandemic. I believe that even before the healthcare personnel or workforce would come to help us, dapat every family should be leading their own
PAC independently. Mental health po, Mayor, is I believe very important so that we can take care of our own, at importante po na hindi magpanic even while you are having symptoms. And we will have that seminar po or webinar virtual on May 13. Sa ating mga kapitan po, please may I set a date with you. Sana po you will give importance to this webinar so that we can take care of our mental health. For may we also ask Attorney Net for the guidelines for the percent of workforce. Parang hindi ko yata narinig si Attorney Net doon sa guidelines. So I just ask very briefly, Attorney Net, kung ano yung guideline natin sa mga government offices.
Yes, Conscrier. Status ko pa rin po tayo, ma'am. So, Executive Order number 60 shall continue to be implemented, ma'am. Wherein from Mondays to Wednesday, 30% po ang allowed. And then during Thursday and Friday po, 10% lang po yung allowed, ma'am.
Okay. We put that in the CIO page, Attorney Net, Ma'am Lenny, so that the government employees will also be apprised of the updates. Thank you. Thank you po, Mayor. Mabala.
Mayor?
Go ahead po.
Okay, Mayor, si Lenny po ulit ito ng CIO. So, going back to our press briefing, we have a few friends from the media po who would like to ask some questions.
We will proceed now to Q&A then. Okay, go ahead.
First in line, sir, may I call on Sir? Yes, sir. Yes, sir. May I now call on Sir Pabs Mamawag po para po sa kanyang question. Balikan ko po si Sir Pops kung wala pa po siya. Ang second po is Sir Joshua.
Hello, Ma'am Len. Hello, Mayor. Good afternoon. Mayor, can you hear me po?
Yes, Josh, go ahead.
Mayor, i-clarify lang namin, no? Kasi dito adjustment ng memorandum circuit, yung joint memorandum. Sinabi na may adjustment tayo dun sa mga barbers shop, parlors, and spa. Ang sinabi specifically, nail spa lang. So, definitely, walang spa like yung massage spa, no? Parang
Yung katanungan po natin.
Hello?
Yes, Josh, go ahead. I can hear you and I can hear you clearly. Okay.
Yes, Mayor, i-clarify lang natin yung yung memorandum circular na binaba ng IATF, yung bago, yung sa regarding sa barbershops, parlors, and spa. Naka-emphasize kasi doon, nail spa lang, no? So, definitely, hindi pwedeng mag-operate yung mga massage spa. Can you clarify this for the public?
Yes, nail spa pa lang po ang pwede. Yung massage and others, hindi pa po pwede yung personal care na gano'n. Nail
Mayor,
po.
paano pag yung isang spa is meron silang nail, then meron silang massage. Paano nila yun? Can they still operate with the nail lang?
Mayor,
Nail lang
can I
po,
answer?
bawal po.
Mayor, it's Attorney Net. Can I add?
Sige, Mayor.
Sandali lang. Si Josh po ang nagtatanong.
Yes, Mayor. It's Attorney Net. Can I add to your answer po doon sa query po ni
Yes,
Sir
Attorney Net,
Josh?
go ahead. Go ahead.
Yes po.
Go ahead,
So,
Attorney Net.
Sir Josh, for for businesses po, like beauty salons na meron din pong massage, mga ganun po, under IATF guidelines po, Sir Josh, yung ating pong beauty salons, their operation shall only be limited to providing services that can accommodate the wearing of face masks at all times by client and service providers. So ito pong mga salons na to, Sir Josh, yung mga services lang po nila na naka-face mask po o face shield ang atin pong mga kliyente, yun lang po yung i-offer nila. Pag massage po, yung mga makeup, ganun po, dahil tatanggalin po yung face mask nila po doon, hindi po nila pwedeng offer po yun as services po nila. So limited din po yung services po na pwedeng i-offer po nitong mga beauty salons and parlors po, Sir Josh.
Thank you,
So pati facial, Bawal,
Yes.
attorney.
Yes, Vice. Bawal din po, Vice. Kasi sa facial po, definitely walang wearing of face mask po doon. So, not allowed po.
Okay.
Thank you, Mayor. Thank you.
Yes, Josh, thank you. Thank you for that.
Mayor, si Ma'am Dina Villacampa also has a question.
Dina, go ahead, Dina. Good afternoon,
Yes,
Dina.
Yes, good afternoon, Mayor. I think yung question ko ay for Dr. Doc Harichua regarding sa vaccination. Doc, since marami po yung mga hindi pumunta na mga indigent SC dun sa kanilang scheduled bakuna, pwede ba silang maki-schedule kaya o medyo nagbago yung kanilang isip, Doc? Kasi yung iba, prefer daw po nila ang AstraZeneca sa Sinovac.
May I answer that? Dr.
Yes,
Joe? Dr. Joe, may I answer that?
Yes, sir. Yes, sir.
Okay, ang sitwasyon po natin is wala na pong pipili. Kapag pumili ka po, gaya ng sa isang barangay na pinunta ni na Dr. Joe, nag-schedule sila yung first barangay na schedule namin, yung indigent senior citizens. Once na natapos yung schedule ninyo, nagbago ang isip mo, hindi ka basta-basta pwede. Babalikan ka na lang after natapos yung ibang schedules. So yun po yung sitwasyon natin. Kapag ito na yung time mo na magpabakuna, sinabi mo, ay hindi po ako magpapabakuna muna. I-finorfit mo po yung priority mo. So ikaw po yung lilinya ka na naman sa pinakamahuling priority. So gaya niyan, assuming yung barangay 1, naglagay kami ng schedule dyan, ayaw na mga senior citizens, yung iba, ayaw nila. And then nagbago ang isip nila sa following day, doon sa barangay 2. Hindi po sila pwedeng pumunta sa barangay 2. Hintayin na naman nila na matapos yung ibang barangays, saka na lang ulit na babalik doon pag may available na vaccine. Dr. Joe, correct me if I'm wrong.
Yes. Thank you, Mayor. Thank you sa pagpapaalala po na yun po yung ginagawa po natin ngayon na process doon sa pagpili po kung yung sa pag-schedule po natin ng bakuna. So yun po yung talagang ginagawa po natin ngayon, Mayor.
Thank you, thank you. Para may order ang pagbakuna. Kasi kung gusto mo lang, hindi pwede. Wala tayong order nun. Susulpot ka lang, hindi po pwede yun. Pag nakasign sa barangay mo, yun. Pag ayaw mo sa una, okay lang. Balikan ka namin, pero pag matapos na po yung ibang mga barangays. Ganun po yun.
What about the vaccine, Mayor? Hindi na sila pwedeng mamili.
Kahit na kung gusto lang pipili sila, pero we discourage. Pare-parehas naman po yung vaccine. Ako nga, nagpabaksin ako ng Sinovac. Paripakita po lang yung kumpiyansa natin sa vaccine. So, kung gusto lang AstraZeneca, maghintay sila. Maghintay sila ng AstraZeneca. Ngunit, by priority po yon. Pag natapos sa barangay na ninyo, balikan na lang po namin kayo pag matapos na po yung iba. Kapag nag-pass ka po. So, ganun po yung sitwasyon.
Para po, Doc Joe, kumusta po ang turnout? I mean, ating second priority for the SC, gumaganda ba? Dumarami po ba ang nagpaparehistro na because of the rollout ng vaccine sa SC?
Sa ngayon po, ma'am, medyo may mga barangays na yung parang pupuntahan pa lang namin na barangays. Medyo madami na ng konti yung magpapabakuna na SC. Pero as to the indigents po, doon po talaga kami nahihirapan na maghikayat na kasi ang inuna po natin are the indigents po, indigent senior citizens. Yun po yung medyo nahihirapan kami na maghikayat na yung sa mga even with sa mga susunod na barangays na pupuntahan namin, parang kukonti pa rin yung nag-yes sa kanila na magpabakuna. Yung sa mga hindi po indigents, yun na po yung medyo dumadami.
May I add to that, Dr. Joe? Dina, we did not stop there. Ang ginawa ulit namin is nag-print na kami ngayon ng flyers, tinatapos lang namin ang mga ilalagay namin sa flyers we will reach out to all our eligible population. And puspusan po yung information drive as to the vaccination. Di ba yung tawag po natin sa Tuguegarao, yung hashtag natin, tara na magpabakuna para ligtas ang buong pamilya. Yun po yung ginagawa po natin sa mga vaccination. Para mahikayat po natin yung mga kababayan natin na magpabakuna so that we can give confidence. Ako, the confidence that I got the confidence from the doctors themselves. Yung doctors natin, yung healthcare workers natin, nagpapabakuna. Anong rason na hindi ako pwede? Ayaw ako magpabakuna. Kaya nagpabakuna din po ako para sa ganun yung mga kababayan po natin. Makabigyan po ng kumpiyansa na magpabakuna po sila. Napakaganda po para makabalik na po tayo sa normal. Ang Israel hindi na po gumagamit ng face mask kasi lahat na ng tao nagpabakuna. Ang ibang mga countries, I think New Zealand is going to that. Some in Australia, some in China, some in the United States. May Miss Universe na nga. So, magpabakuna po tayo para makabalik na po tayo ng normal, para wala na po tayong masyadong may balik na po natin yung mga ginagawa po natin, ekonomiya po natin, sayang po ekonomiya ng Tuguegarao, mapaakyat ulit po natin ang ekonomiya natin. Wala pong mamatay na mahal po natin sa buhay. Wala na po tayong iiyakan. Hindi po tayo iiyak at may namatay na hindi natin makikita na. Kasi may protocol, within 24 hours kailangan ilibing po yung biktima po ng COVID. So mga kapatid ko, disiplina po ang kailangan. Yes, Dina?
Pwede pa pong isa. Sorry. Mayor, speaking of economy ng Tuguegarao, kumusta po ito? Nilabas na po ng PSA ang kanilang data, negative 9.9 po ang Region 2.
Again, Dina, please. Dina.
Kumusta po ang economy po ng Tuguegarao after this, during the pandemic po?
Very unfortunate, but we expected this. Ang nagpa-rehistro po ng mga establishments, bumaba po yan from 10 to 20%. And we expected this. Ang mostly affected talaga na nagsara yung mga maliliit. That's why kung tingnan po ninyo, nagro-roll out kami ng mga para sa livelihood ng mga tao. Mga livelihood, pansamantala lang po. Kaya nga, ang call namin is, huwag mo nang isipin yung ganansya. Survival po muna ng negosyo ang isipin natin. And then later on, pag normal na, saka na yung ganansya ang isipin natin. Maka-survive lang po yung economy natin. Kaya nga, nag-roll out kami ng konting tulong sa ating mga kababayan sa livelihood nila. Ang nag-evaluate po dyan yung TLDO natin, si Mario Eugenio. Nagbigay po na tayo initially ng mga 10,000 para makatulong lang doon sa mga maliliit na negosyante po natin na nandyan lang sa daan-daan, mga ambulant vendors, vegetable vendors ang isusunod natin para sa ganun po mabuhay lang po muna. Yun po yung ginagawa po natin ngayon. Mga 20% bumaba po ang ekonomiya po natin sa malaki po yun. Malaking bagay po yun sa Tuguegarao.
Thank you po, Mayor.
Thank you, Ma'am Dina. Gusto ko pong tawagin naman si Sir TJ Tuddaw po.
Yes, ma'am. Thank you. Good afternoon po sa lahat. Good afternoon, Mayor.
TJ, good afternoon.
Yes, Mayor, since pinagbabawal po natin o kaya yung pong mga mass gathering, no? Kumusta po yung ano po natin dahil ongoing yung mga ilan natin nakikita natin sa mga barangay, yung pong community pantries nila at kumpulan po din, ibig sabihin ipapa-stop po natin ito o ano na lang po, alalayan na lang natin.
TJ, hindi naman po mass gathering yung community pantry, parang ano yun parang sa palengke. Ngunit we have to come up with protocols. That's why we will have a meeting. Si ex-Councilor Jude, ex-Councilor Ken, and Ray Ferrer, Sila po yung in charge dyan. They will meet, and of course, Councilor Karen and ex-officio Councilor Karen and Cap Bajil, the president of the federation. They will meet with all the barangay captains tomorrow, and then they will discuss on the protocols that we have with our community pantries. Almost 40 ang community pantries natin ngayon out of 49, and hopefully meron tayong community pantries all over the Tuguegarao. Ang basic guideline ko lang po dyan is the main purpose of the community pantry is para makatulong sa mga talagang nangangailangan. But my basic guideline there is it should not compete with our vendors. It should not compete with our vegetable sellers in the morning. So ang nasa sa isip ko po dyan, nung nag-usap-usap kami si Attorney Romy, si CA, si Kendrick, si Engineer Kendrick, si Jude Bayon, at si Ray Ferrer, at si Karen and Cap Bajil, is we will come up with a protocol in such a way na it will not conflict with yung schedule nila, will not conflict with our vendors in the morning and with our talipapa in the late afternoon. Para lahat po matulungan din po yung ating community pantries. And ang ginawa po namin dyan is sinadjust ko po dyan is yung mga vegetables, bibili na rin po natin sa mga vendors natin. Yung gustong tumulong, kukuha ng bibili ng vegetables doon sa mga ambulant vendors o sa mga vendors natin sa Don Domingo, and then yun ang i-donate natin sa mga pantries po namin para at least mabuhay din po natin yung mga maliliit na negosyante natin para mag-thrive po yung negosyo. But we will be coming up with protocols nga. Tama po yung sabi nyo. We encourage everybody to put their community pantries in an open space. Open talaga yung space. Kung pwede mamarkahan po, kung pwede po magkaroon ng upuan para sa ganun malalayo yung mga tao. Yun po yung mga i-discuss nila bukas na Engineer Kendrick, Councilor Karen, President Bajil, si ex-Councilor Jude, and Ray Ferrer, our new executive assistant, helping the community affairs. Because Councilor Jude, ex-Councilor Jude took over Engineer Ken. Engineer Ken, umakyat po si Engineer Ken as assistant GSO. Katulong po ni Jude Santos sa GSO po natin.
Mayor, kamusta rin po yung update po natin dito sa curfew? Wala rin nagbago?
Walang pagbabago ang curfew natin. 10 to 4 ang curfew natin. All other protocols walang pagbabago except yung sinabi ni Atty.
Juan, Mayor?
Yes, Ben.
As you have mentioned a while ago na imimit po nila yung barangay captains.
Yes.
For the protocols ng pantry.
Yes, SK and barangay captains.
Okay. Hindi ko narinig po yung SK chairman po. Sorry.
Pati SK po.
Okay. Idagdag ko na rin po, Mayor, yung put din po regarding sa mga network po na nagpapalit ng SIM. Sana ipagbawal din po natin muna yon.
Ano, Ben? Ano yon?
May mga network kasi, mga cellphone network po, Mayor, na umiikot, nag-aano ng mga SIM card, ganyan po, Mayor. Maramihan po din sila yon. From one place to another po sila eh. Kung pwede, ipagbawal po natin muna yan.
Lahat po ng umiikot, bawal po muna. MECQ pa po tayo. Hintayin
Yes
po
po,
yung
pero
MECQ tayo.
yes po, pero may mga umiikot nga po na nagwo-work sa mga cellphone, hindi ko na sabihin kung anong network po yon, pero may mga ganun pong umiikot.
We will call the attention of Loob and Smart. Silang dalawa lang naman po yan. We will call the attention of the head of Loob and Smart in Tuguegarao. Thank you. Dapat wala mo nang ikot-ikot. MECQ pa lang po tayo.
Okay.
Hintayin po ninyo MGCQ. Essentials pa lang po ang kailangan MECQ. Lumabas kayo, essential. Medicines, food. Appointment with
Mayor?
doctors. Yes.
Sige sir, my next question lang po for Sir Vil Visaya of Philippine Daily Inquirer.
Bill of
Yes.
Inquirer. Yes. go
Magandang
ahead, Bill.
magandang hapon, Mayor.
Magandang
Dito
hapon,
nga,
Bill.
Opo, dahil nga dito sa extended MECQ, maraming mga lumalabas na post ng mga residente ng Tuguegarao sa social media na they are saying their frustrations, fatigue, boredom, kakulangan ng pera, and some are claiming na there is that unstable yung mental health ng ibang mga residente. So, sa mga ganitong pagkakataon, Mayor, paano mababawasan yung ganito mga situation, especially yung mga residente talagang in Filipino word buryong na sila. Ano yung mga magagawang pamamaraan ng local government unit ng Tuguegarao hinggil dito?
Yes, Bill, I think Dr. James should put up a program para doon sa mga medyo mentally unstable na po.
Kaya pag-ibigay ako.
Sa-
Hindi na ako eh. Hindi na ako.
Ayaw pa. Sir, Mayor.
Yes.
Opo,
Yes,
Doc.
taxi si President Totoy, sandali. May I finish, Dr. James? Ang natin na Dr. James is come up with a program para sa mga ganun, isa-isa po nating tawagin, lalo yung mga emotionally unstable already because of the haba na ng quarantine. We can understand that, but we have to go through this. I can understand the situation of the others, but my suggestion, you go back to your family. You always go back to your family. You mingle again with the family. You connect again with your family. Kailangan po yun ang ganun na sitwasyon. Ang tatakbuhan po natin sa mga pag medyo buryo-buryong na tayo is yung pamilya po. Yun ang pinakaunang takbuhan po natin. Yung pamilya po natin. Yes, Dr. James.
Yes, sir. Kung meron po tayo yung helpline, no? Nakasama po natin ang St. Paul University College of Medicine at saka yung mga gabay kagayan, no, na doktor. Meron din tayo pong grupo ng and we will publish that, no? Siguro I'll consolidate lang the contact numbers. We now have people from the religious sector and yung ating mga trained counselors. Actually, they can be reached out through a number. Yes, we believe, sir, no, na marami sa ating mga kababayan ngayon ay emotionally unstable dahil sa tagal na ng pandemyang ito. And 2 days ago, I just signed again another death certificate of another suicide attempt of a very young man, 23 years old, very able-bodied, working, but due to when I interviewed the family, no, sabi niya parang depressed yung brother niya, hindi nila napansin na yung pala ay nagbitay na. So again, no, really, we have faces, we have names of people who are suffering emotionally because of this pandemic. For whatever reasons, whether it's financial, emotional, economic, or whatever, no, or relationships in the family, then definitely they need a counselor. Now we have a group headed by some priests, from Catholic priests, and some lay ministers who can do counseling by phone. We have contact numbers for you. Call the helpline and we will connect you to that number.
Dr. James.
Thank you very much, Doc.
Dr. James.
Yes, sir.
You link with Len. We post that in our LED wall and in our CIO page.
Yes, sir.
Every day.
Noted,
Every
Mayor.
day. Thank you. Yes, Bill.
Thank you po, Mayor. Maraming salamat.
Maraming salamat, Bill.
May mga katanungan pa po ba mula sa ating mga
Ako.
barangay at friends from the media?
Mayor.
Yes, President Totoy, Councilor Totoy, the youngest in our group. Yes po.
Tama. The youngest is still healthy. Yeah.
Yes, is still serving the good Tuguegaraweños.
Mayor, I noticed that, right now, our university is being inspected by through Zoom. And so we have to let our employees report so they can make share their knowledge of what's happening. Now, I think so far, so good. None of my employees are affected by COVID. So I think it's a matter of implementing strictly the minimum
Health standards.
health standard. So it's a matter of discipline on the part of our employees. So I'm very happy to report that so far, none yet has been affected by COVID because of our strict rule that they should wear their masks and face shield while in office. So this is a matter of I'm saying this so everybody will follow. Keep yourself clean. Wash hands very often. That's what we do. We give them alcohol. We give them Lysol so that to avoid the COVID to attack them. So my advice is let our employees do the same. Let our people know that if we are following strict compliance of the minimum health standard, we can avoid this. Thank you.
Thank you, President Totoy. Maybe next time, or maybe you can come up with the best practices of UCB so that we can share it with other establishments. Especially, President Totoy, what I have observed, Councilor Totoy, is yung eating together during lunch or meals. Because you have to remove your mask. Kaya nga, ang naging protocol na po namin sa opisina, dahil nangyari na po sa opisina namin, is kain na lang po kami sa sarili naming table. Nakabalot-balot na po yan, and then we eat in our own, on our own table. Yes po.
They bring their own food. And they eat
yes.
Oh.
Hindi na po magkumpul-kumpul ngayon because now is not the time for socializing, except only when I give instructions to our men. That's the only time that we are together in the office. Yet, we always wear masks. We require our people to always wear masks and face shield. Thank you, President Totoy. Maraming salamat po.
You're doing very well, Mayor.
Thank you, sir. Thank you, sir. Thank you. Anything more, Len?
Thank you po,
Stay
Sir
safe po,
Totoy.
Manang Totoy. Yes. Anything
Maybe
more, Len?
Sa ngayon, sir, wala na po sa listahan natin. Baka may mga barangay captains din po na gusto magtanong.
I think we are done, Len. So thank you again to the members of the 8th City Council, Vice Mayor Benben,
Sir,
Atty.
last,
Romy
sir.
Calubak. Yes,
Sir.
Ben, go ahead. Go
Sir,
ahead,
yes,
go ahead.
our appeal to our barangay captains again. Allowed na po ang 10% na dine-in. Just see to it po, lalo na especially mga pansita natin. I'm sure takam na naman ang ating mga kababayan na kumain. Dadagsa po sila yan sa pansitan. So please, postehan po ninyo ang mga pansitan po. Make it sure na hanggang 10% lang po talaga ang capacity po nila na for dine-in po. Yun lang po ang pakiusap po natin dahil sigurado ako natakam lahat ang mga kababayan natin na kumain po ng pansit.
Thank you, barangay captains. But we will also require BPLO to go around. We also require BPLO, Engineer Ines, your inspection teams please go around our pansiterias. Please go around our pansiterias. It is very, very important. Kasi dyan po nakakahawaan sa kainan. Why? Because we have to remove our mask. Yun po ang number 1 defense po natin dito, our mask. May second defense po natin is the face shield. But wear your mask, kung pwede magdoble ang mask ngayon, doblehin po natin. Because in the genotyping, wala pa pong advice sa atin sa genotyping ng nangyari sa Tuguegarao. Ngunit I suspect na meron na po tayong variant sa Tuguegarao. I just suspect because of the spike of cases in only a very short time. So I hope, Dr. James, if you can link with DOH as soon as possible so that we'll know our real condition in Tuguegarao insofar as genotyping is concerned kung meron ng variant sa atin o wala. Dr. James?
Yes, sir. Yes, sir. I'll do that, sir. Sir, just an update, no? Kasi yung data kanina na positivity rate natin. Alam mo, sir, out of 3,877 na swabs na ginawa natin for the whole month of April, no? 1,011 of these turned out to be positive. So we have a very high positivity rate of 26%. So for every 10 na sinaswab natin, halos
2.6. 2.6.
Yes. 2.5.
Almost 3. 3%. Almost 3
3.
persons in every 10 na swab.
Become positive. Yes, sir.
So I think we should be extra careful, extra careful, Dr. James, because I believe there is already something wrong insofar as COVID cases in Tuguegarao, insofar as the variant is concerned. Alam po natin na marami nagagaling sa Cordillera na pumupunta sa Tuguegarao, and hindi naman, we do not blame anybody. Parte po yan ng buhay. Parte po yan ng buhay yung mabuti kung alam mo, mabuti kung gusto mo ring mahawa yung kapwa mo. Nagkataon po na ganun. So we have to be extra careful. And Dr. James, please link with Director Rio magpantay so that we'll know our real situation in Tuguegarao. May I give this time to